So my role as senior manager managing the integrated discharge teams within Hertfordshire, it is predominantly teams of social work professionals that work jointly along with discharge planning nurses, therapy, discharge leads, etc., across hospitals. Majority of the people that get referred to us come under an older persons category. They are all people that the trust, that the NHS believe require care and support of one description or another to enable them to be discharged safely. He wasn't known to the local authority before. He was late 70s. He had in early December falling on some ice in the very early cold spell, and was conveyed to a London hospital because he was in that area when he fell, and required surgery to repair his hip. It was apparent when he got home, within about an hour, the therapist visited, and the first call to us within minutes was, "This house is not livable. This house is uninhabitable." His heating had broken, and the house was damp, and we were expecting -2 degrees that night. He was also concerned about staying there, but likewise did not want to have to go back to hospital. Therefore, we were able to talk to him about the possibility of going to a care home just for a few days until we could get his property up to standard. Care homes still ask for a negative COVID swab. We did not have time to play with it. It was 5 o'clock in the evening. It was already dark. It was already getting cold. We did not have the ability to get someone out there from a partner agency to bring a swab, to collect, to take a swab and to wait for the results. We could have tried ringing the GP. We know how busy they are. We could have continued to ring the GP to try and get them to look at his file. However, one of my staff working with this gentleman remembered that we had just had shared care records introduced. In addition, she was able to look at the London shared records and be able to see in hospital that they had completed a number of COVID tests, which were all negative. She was therefore able to share that information and level of assurance with the care home, who agreed for him to be transferred to their care home as soon as we could get him there. So that's probably 2 hours saved of my time, my team's time. We also did not require any other professional to go out with a testing kit to complete his COVID swab, which was easily probably another 2 hours of time. There was no time required for any lab results. There was no time required chasing NHS 111 if it had gone past a certain time and the GP was no longer answering their phone. So between health and social care professionals, I anticipate it possibly saved about 10 hours. I'm actually more impressed with what it gave to P himself. It meant he didn't have to undergo another test. It meant he didn't have a number of hours of worrying where he's going to be that night and how he's going to manage without going back to hospital. And it meant by 9:30, he was in a safe place. He was warm. He was having a cup of tea. And he knew he was going to have a proper bed to sleep in that night that wasn't damp, and he was going to be kept warm.